Dozens of people from the medical and island community gathered for the Guam Comprehensive Cancer Control Summit. And while it was a day full of facts and presentations, it wasn't until keynote speaker Remy Zuniga told her story of surviving cancer that people understood how taxing and costly beating this disease can be. You see, this mother of three not only is fighting breast and kidney cancer, her insurance to cover her treatments ran out about a month ago, leaving her with nothing but hope that she will survive.
Where do I go from here? I have no insurance. I am a single parent of three for the last 12 years. I do not qualify with MIP. I was denied for Social Security medical disability. I am unable to afford $1,000 monthly for insurance premium on personal subscription. I am unable to afford $7,000 cost of the oral medications every 8 weeks, every 28 days.
Dr. Annette David, chairperson of the Cancer Control Coalition, says the purpose of the summit is to make a connection between those in the medical field and policymakers so adequate funding can be obtained to solve situations like the one Remy is in.
I think the issue is how do we find sustainable funding, sustainable resources for something that can be so devastating as cancer. The lady who spoke was a very courageous lady. She's actually battled 2 cancers. And the sad thing is now her employer will no longer continue her insurance coverage. So where is the justice in that? I think the key is for us to work together as a community to really look for very sustainable and practical ways of finding the resources to help people like Remy.
One of the many that were touched by Remy's story was Senator Tina Muñoz-Barnes, who says she was willing to think outside the box to find funding that can support uninsured patients with their cancer treatments.
As we look at the budget constraints that we have today, I can't turn my back and say, no, I want to give. But where is it? We need resources, we need funding, and if we can't get it from grants, that we've got to think outside the box, and maybe even reaching out to our international brothers and sisters is maybe an option that we can look at.
While Senator Barnes says she will also look at programs and foundations for patients, she admits she can't do it alone. In the meantime, Dr. David says preventative measures are key to counter a person's chances of getting cancer and recommends these simple tips.
Once you have the cancer, the costs are tremendous, but we can do very simple things really to help reduce our risk, and we become tobacco-free, moderate the alcohol that we consume, have a healthy diet, and exercise. Those 4 very simple things. They don't cost you anything, and they can save you so much, but we do need to be proactive and get the message out.
Josh Dikenko, Pacific News Center.